Gentlemen, what if I told you that semen isn't simply semen, but a biological cocktail so complex that it can influence a woman's mood, her sleep, her immune system, and even her health during pregnancy? Would you believe me? I'm Dr. Evelyn Carter, a urologist specialized in sexual and reproductive health, and today we're going to talk about something that almost no doctor dares to explain clearly. What really happens in a woman's body when she comes into contact with a man's semen, whether orally or vaginally. Get ready, because what you're about to hear is not a myth, not an opinion, not something from the internet. It's pure science, and I guarantee it will surprise you. If this topic interests you, write a 1 in the comments and stay until the end, because I'm going to reveal scientific studies that very few people know about. Before continuing, let me tell you something important. This topic has nothing to do with sensationalism or taboos. It has to do with human biology, with understanding how the male and female body communicate chemically. A silent but powerful communication that has been studied for decades by scientists around the world. And the results are absolutely fascinating. Let's start with the real composition of semen. Many men believe that semen is basically sperm, but actually sperm cells represent only between 5% and 10% of the total volume. Yes, you heard that right. Only 5 to 10%. The remaining 90% is a highly sophisticated fluid called seminal plasma, a mixture designed by evolution to protect, nourish, energize, and transport male genetic information. That liquid contains more than 200 different proteins, essential minerals, specific enzymes, immunological factors, and most surprisingly, hormones and neurochemicals identical to those that regulate the human brain. When I say identical, I mean exactly the same molecules that your brain produces naturally. When a woman has intimate contact with a man's semen, she's receiving substances like oxytocin, the hormone of bonding, trust and emotional attachment, serotonin, which regulates mood and general well-being, melatonin, responsible for sleep and deep relaxation, cortisol, which modulates the immune response and stress, and NGF, nerve growth factor, which protects and regenerates nerve cells. These molecules weren't designed to give pleasure, although that's a pleasant side effect. Their original purpose is much deeper, to favor reproduction, protect male DNA during its journey to the egg, and facilitate fertility by creating a favorable chemical environment. But when these substances enter female blood through the mouth or vagina, they produce unexpected effects. And this is where science becomes absolutely incredible. Let me tell you about Laura's case, a 34-year-old patient from Chicago who came to my office with a very specific question. Doctor, I've noticed that when my partner and I stopped using condoms, I feel different emotionally, more calm, I sleep better, even my anxiety has decreased. Is that possible, or am I imagining it? I told her she wasn't imagining it, and now I'm going to explain why. The first scientifically documented effect is the impact on mood and emotional bonding. One of the most talked about studies in the scientific world comes from the State University of New York at Albany. In a study conducted with 293 women, scientists discovered something explosive that changed the way we understand sexual biology. Women exposed to their partner's semen without a condom reported significantly fewer depressive symptoms, greater sense of well-being, and much lower levels of anxiety compared to women who always used condoms. I'm not saying condoms are bad. On the contrary, they're fundamental for preventing diseases. But this study showed us something we'd never considered. Why does this happen? Because the substances present in semen, oxytocin, serotonin, melatonin can be absorbed directly through vaginal or oral mucous membranes. Mucous membranes are highly permeable tissues designed to absorb molecules. It's the same principle by which sublingual medications or suppositories work. Biologically, it's as if the male body were sending a direct chemical message to the female body. Relax. Sleep better, reduce stress, bond with me. It's not magic, it's pure physiology. Oxytocin levels especially, that hormone your brain releases when you hug someone you love. when you nurse a baby, when you feel deep connection with another person, are present in significant concentrations in seminal plasma. Laura asked me directly, "So, doctor, is my brain receiving those hormones from my partner's semen?" "Exactly," I answered. "Your body is absorbing those neurochemicals and responding to them. That's why you feel calmer, more emotionally connected. It's not psychological, although the emotional part also influences. It's biochemical. But this is just the beginning. The second documented effect is even more surprising and has to do with the immune system and pregnancy. Here, science becomes fascinating in a way that few doctors explain to their patients. Semen can act as a natural form of immunological vaccine. Let me explain how it works. For a woman's body, male DNA is technically a foreign invader. When a couple tries to conceive, the female immune system must learn to tolerate the man's genetic material. If it doesn't, the woman's body can attack the embryo as if it were a threat. And here comes the incredible part. How does that immune system learn to tolerate the father's DNA? Through repeated exposure to semen. Studies conducted in multiple countries, including research in Australia, the Netherlands, and the United States, have demonstrated something shocking. Couples who consistently use condoms before trying to conceive have a significantly higher risk of suffering from preeclampsia, a serious pregnancy disease that can endanger both mother and baby. One particularly detailed study published in the Journal of Reproductive Immunology showed that women with less than 4 months of exposure to their partner's semen have up to 17 times more risk of developing preeclampsia. 17 times. That's not a typo. Women with regular exposure to their partner's semen for at least 1 year before conceiving have dramatically lower risks. Why does this happen? Because seminal plasma contains paternal antigens, small samples of the man's genetic information. The woman, by being exposed to them regularly, develops what we call immunological tolerance. Simply put, semen helps the female body recognize the father's DNA as something safe, not as a threat that must be attacked. It's like when you get vaccinated. They expose you to a small amount of the virus so your body learns to recognize it and doesn't react excessively when you encounter the real virus. Semen works similarly to prepare the female body for a successful pregnancy. I knew the case of Patricia and Michael, a couple ages 38 and 40 from Boston. They'd been trying to conceive for 2 years without success. They'd used condoms during the first 8 years of their relationship, and when they decided to try for a baby, they simply stopped using them. Patricia had 3 miscarriages in the first trimester, devastating for both. When I reviewed their complete medical history and explained the science behind semen exposure, they decided to wait. I recommended that for 6 months they maintain regular relations without protection, but without the pressure of conceiving immediately. Just allow Patricia's body to get used to Michael's genetic material. 7 months later, Patricia got pregnant. This time, the pregnancy progressed without complications. Today, they have a healthy 2-year-old girl. Was it just semen exposure that changed everything? I can't say it was the only factor, but science strongly suggests it played a fundamental role. Now comes the part that generates the most curiosity. The third effect: what happens when a woman swallows semen? Here, science also has clear and documented answers. The mucous membranes of the mouth are highly absorbent, even more than vaginal mucous membranes in some aspects. The surface under the tongue, for example, is one of the most permeable areas of the human body. Semen compounds can enter the bloodstream through these membranes and cause measurable effects. Deep relaxation due to melatonin, natural drowsiness, especially if it occurs at night, sense of well-being from serotonin, temporary stress reduction thanks to present endorphins, all due to melatonin, oxytocin, and serotonin present in seminal plasma. I had a patient named Carmen, 42 years old, from Houston, who asked me a direct question in the office. "Doctor, my partner says he read that swallowing semen is good for health. Is that true, or is it just something men say to convince women?" I answered with complete honesty. There are real biological effects, yes, but There are also risks that must be considered. Studies show that some women experience improvements in mood after oral contact with semen. Not all, but some do. The key is understanding that this isn't medicine or a supplement. It's simply a biological interaction between two bodies. If there's trust, if there's love, if there's shared sexual health, those effects can be positive. But it should never be done under pressure or obligation. And this is where I must be absolutely responsible as a doctor. Because yes, there are potential positive effects, but there are also significant risks that every woman and every man should know before making decisions about their sexual life. The biggest risk is sexually transmitted diseases. Semen is a direct vehicle for HIV, human papillomavirus, herpes, gonorrhea, chlamydia, syphilis, hepatitis B and C. The mouth and vagina are extremely permeable zones designed to absorb. That means they also absorb viruses and bacteria easily. A single exposure to the semen of an infected person can transmit a disease that changes your life forever. HIV, for example, can be transmitted orally if there are small wounds in the mouth, bleeding gums, or even irritation from recent toothbrushing. It's not common, but it's possible, and possible means real risk. The second risk is semen allergy. Few women have it, approximately 1% of the female population, but it exists and is real. It's called hypersensitivity to seminal plasma. It can cause anything from mild itching and redness to severe reactions like difficulty breathing and anaphylaxis, which is a medical emergency. I treated a 29-year-old woman, Sophia from Phoenix, who arrived at the emergency room with a swollen face, difficulty breathing, and severe hives after having oral contact with her boyfriend's semen. She'd never had that reaction before. It was her first time performing oral sex, and it almost ended in tragedy. Fortunately, she responded well to antihistamines and corticosteroids, but it was terrifying for everyone. The third risk is toxins depending on the man's lifestyle. Everything a man consumes, alcohol, drugs, medications, tobacco, supplements, can appear in seminal fluid. If a man regularly consumes drugs or takes strong medications, those substances can be present in detectable concentrations in his semen. I've seen cases of women who developed intense nausea, headaches, and discomfort after contact with semen from partners who consumed alcohol excessively. The female body was literally absorbing alcohol metabolites. That's why a man's health matters as much as a woman's in a sexual relationship. I also want to talk about something many couples don't consider: the importance of emotional context. The positive effects of semen on mood and emotional bonding only occur in a context of healthy relationship, mutual trust, love, and respect. If there's pressure, if there's manipulation, if there's lack of respect, all those positive effects disappear. I remember the case of Helen, 36 years old, from Seattle, who came to the office because her partner constantly pressured her to have sex without protection and perform practices she didn't enjoy. He used arguments like, "It's natural, it's healthy, it'll make you feel better." But Helen felt worse and worse, more anxious, more depressed. I explained something fundamental. The positive biological effects of semen only work when there's genuine consent, when there's real desire, when there's love and mutual care. If you feel pressured, your brain releases cortisol, the stress hormone, in enormous amounts, and that completely cancels out any benefit from the oxytocin or serotonin present in semen. I gave her permission, so to speak, to establish clear boundaries with her partner. Your body is yours. Your decisions are yours. Sexual health is about well-being, not about fulfilling someone else's expectations. Helen ended that relationship and months later met someone who deeply respected her. Today, she tells me her sex life is infinitely better, not because of semen biology, but because of the context of love and respect in which it occurs. Now I want to give you clear recommendations if you and your partner decide to have contact without barrier protection. First, both must get complete tests for sexually transmitted diseases: HIV, syphilis, gonorrhea, chlamydia, hepatitis B and C, herpes. Both, not just one, both. Second, the relationship must be monogamous and stable. Risks increase exponentially if there are multiple partners. Third, both must lead a healthy lifestyle. Avoid drugs, moderate alcohol, take care of nutrition. Remember that everything you consume can appear in your bodily fluids. Fourth, if you're trying to conceive, consider regular exposure to semen for at least 6 months before actively trying for pregnancy. This helps the female immune system prepare. And fifth, communication is fundamental. Talk openly about desires, limits, comfort. A healthy sex life is a talked-about sex life. I want to close with something important. The science behind semen and its effects on the female body is fascinating and real, but it should never be used as an argument to pressure, manipulate, or convince a woman to do something she doesn't want. The positive effects, the emotional bonding, anxiety reduction, immunological preparation for pregnancy, only occur in contexts of love, respect, and genuine consent. If you're a man watching this video, understand that your partner's health should be your priority. Get medical tests. Take care of your lifestyle. Respect her decisions. If you're a woman, remember your body is yours, and so are your decisions. Information is power, but power should be used to take care of yourself, not to please others. Biology is incredible. Chemistry between two people is real, but always, health and respect must come first. If this video opened your eyes, give it a like, comment on what you found most surprising, and subscribe for more serious, clear medical information without taboos. I'm Dr. Evelyn Carter, and your health and your partner's health matter more than you think. See you in the next video. Take care.